150,000 to 450,000. If it is so much, then it will be very, very thick, sticky. So your blood will not circulate. And if it is less than 150,000 platelets, your blood will be so thin. When it starts bleeding, it will not stop. So all these things are really made by bone marrow. So bone marrow, as in a child, stays inside the thigh bone, that is femur, and in adults, hip, that is ilium. You have also spine, ribs, skulls. So there you have bone marrows, and this bone marrow will produce red blood cells, white blood cells, and platelets. So bone marrow is called blood cell factory. Blood cell factory. And you understand, as you have red blood cells, your oxygen, your oxygen will go all parts of your body. You have white blood cells, and that's why you can protect yourself from infection. And platelets will help you blood clot. If it is excessive, then it will be thick. You can have heart attack. And if it is very little, then your bleeding will not stop. That's why a certain range of platelets available in your blood. So if you have problem with bone marrow, then what will happen? Suppose so many white blood cells or so few white blood cells. So many red blood cells, so few red blood cells. Then bad, you have to have certain number of red blood cells and certain number of white blood cells and certain number of platelets. Right. So, bone marrow, if it doesn't properly function, if there's something wrong, then what will happen? It will produce many more red blood cells than necessary, much fewer than necessary, white blood cells, many more, or maybe fewer, maybe many more, or fewer. So, bone marrow will control. But if something is wrong with bone marrow, then this will be a problem. And then you have leukemia, a kind of cancer, blood cancer. You may have aplastic anemia, that is, you will not have enough amount of blood, and certain cancers you will develop. But one thing is good, that is, bone marrow can be transplanted, right?